My next two guests know the damage that COVID can do and just how bad it can get. Timothy Sauvé is 61 years old and he is from Mississauga, Ontario. In February, he underwent a double lung transplant because his lungs were so badly damaged due to COVID-19. Timothy is with me now on the line from Toronto General Hospital, and the surgeon who led the transplant team is Dr. Marcelo Cypel. He joins me from his office at Toronto General Hospital as well. Timothy, let me start with you first. When did you realize that you had coronavirus?
Yes, I can tell you the exact date. It was on December the 8th, a Tuesday, and everything was going well until the evening when I was brushing my teeth. And prior to that, I felt great. But then I stepped backwards to wipe my mouth on a towel, and I actually had a dizzy spell, and I was propelled back into the wall. I was knocked off my feet, and I didn't know what was happening to me.
And so did you call an ambulance? What happened then?
Well, several days went by. I thought it was just nerves because I was about to start a new job within a couple of days, so I didn't know what was happening. I thought it was just nervousness. And then the next day, the morning, on December the 9th, I was leaving my building, and the same thing happened. I was feeling dizzy. I thought this is just nerves, so I didn't really put my finger on it until a couple of days later. December the 14th, which was a Monday, I was feeling so ill. We got driven to a hospital where they did a COVID test on me and actually my whole family. And the following Wednesday, which was the 16th of December, we all discovered, except for my partner, my common law partner, she tested negative for COVID, but the rest of our family tested positive for COVID-19.
Wow. Okay. And what prompted? So you went to the hospital in Mississauga, were diagnosed with COVID yourself and your family members. But what prompted doctors to transfer you to Toronto General, where Dr. Cypel is at?
Okay. What happened there was I was at the Trillium Center in Mississauga for several weeks. They discovered originally I had double pneumonia on the lungs, which quickly turned into pulmonary fibrosis.
Okay,
and that it was. We had many discussions. My future didn't look very, very positive.
I'm going to bet it didn't. Dr. Cypel, I'll bring you in on this. When you took a look at Timothy's lungs, what did you see?
Yeah, so Tim had very established what we call pulmonary fibrosis, which is basically a very severe scar of the lungs. And the lungs basically shrink to about 50% of the normal size. And when they get to that point, we think, and we're pretty sure most of the time the lung cannot recover to a normal state. And that's why we consider assessing him for transplantation at that point.
Yeah, so both lungs had this disease, this fibrosis in them?
Yeah, both lungs, and he was requiring basically maximum amounts of oxygen when he was in Mississauga. And he has been stable on that need for large amount of oxygen, so there was no sign of any improvement in the previous 2 months, basically. And then we were pretty sure that wouldn't recover.
And Timothy, did you know what was going on? I mean, what was your reaction when Dr. Cypel told you what the prognosis was?
When I was transferred to Toronto General, by the way, I'm no longer there. I've been admitted into a rehabilitation center for the past 2 weeks.
Okay.
So I'm no longer in Toronto General, but when I was there, originally, they told me I was going to they were going to attempt, if I passed all the rigors of a physical test, they were going to attempt at the time, I didn't know I was the first patient to do so, but they were going to see if I was eligible for a lung transplant operation. So I was basically waiting. I had to wait days to find out. I went through many, many tests, CAT scans, X-rays, And to tell you the truth, I wasn't even aware that when it did happen, I wasn't aware of the operation at all. I just remember waiting, and then I was out cold. That's all I remember. I don't remember being brought into the operating room, and I don't remember being brought out. I just remember waking up, I don't know how long after the operation, and I just remember waking up, and I was no longer requiring 100% oxygen. I was breathing on my own, and I couldn't believe it. I could not believe it.
Dr. Cypel, what made Timothy such a good candidate for a double lung transplant?
Well, he was previously healthy prior to this, and despite being 2 months in an ICU, all his other organs were functioning normally. I'd like to comment that when he was transferred to us, he was so sick that we had to put him on artificial lung device to keep him basically alive and to gain more time. And he was able to be woken up and disconnected from the ventilator at that point. And that's when we could have the conversation about transplantation, which is very important. And as Tim mentioned, it's a very rigorous assessment and includes a large number of professionals. And the surgery is just one part of it. But there is a psychosocial assessment, there is anesthesia assessment, physiotherapy assessment, and all the medical assessment. And he passed all of those. And as he mentioned, when he was getting to the previous days prior to the transplant, he was getting sicker, and he was no longer, awake at that time. And we were very lucky that we got the donor in time for him.
How much longer do you think he would have had?
It's difficult to say for sure, but the team was already having conversations that if he didn't get a transplant within the following week, he would potentially no longer be a candidate.
What is it about COVID-19 that did this to his lungs?
Yeah, we know that there is a proportion of patients that come to our ICU that develop this ARDS, and some of them can evolve to pulmonary fibrosis. So it's not for the patients for the small subset of patients that get very sick. It's not uncommon that they will have permanent lung damage. But again, many patients do develop other organ dysfunctions, and for that reason, if the lungs don't recover at that time, they are also not candidates for transplantation.
All right, Timothy, last word to you. How are you feeling today?
I'm feeling so much better. I get emotional when I talk about it, but yeah, I'm feeling so much better than I ever thought I would be at this point after the operation. And I have the doctor and the donor and all the staff at Toronto General. I can't thank them enough for giving me my life back.
All right. I want to thank you both for telling this story to the Canadian audience today. It's incredible. Timothy Sauvé, double lung transplant recipient, and the lead surgeon, Dr. Marcelo Cypel, thank you so much.
You're welcome.
On so many levels.
You're welcome.